The pathogenesis of the osteopetrosis. Best explained defect in which of the following? Here the options: osteoclast function, parathyroid hormone receptors, osteoblast function, calcium resorption in proximal tubule, and calcium absorption. So what is the defect occurs in case of osteopetrosis? Osteopetrosis, it is a bone disease in which the excessive turnover of the bones occurs. So what is osteopetrosis? It also known as the marble bone disease. So the another name of the osteopetrosis is the marble bone disease, and it is a rare defective due to defective osteoclast. So it is the defective of the osteoclast, and it also leads to failure of the normal bone resorption. There is defective osteoclast, as osteoclast is responsible for the bone resorption. As the osteoclast is defective in this condition, the bone reabsorption fails. And what is the treatment? Treatment is the stem cell transplant or interferon gamma. So interferon gamma or stem cell transplant, they are the good option for treatment of the osteopetrosis. Now see the osteopetrosis. Here we can see this is the osteoclast, and what osteoclast do? This osteoclast, it causes osteopetrosis, that means or marble bone disease, by excessive destruction of the bones. Here we can see this is the excessive destruction of the bone. And what occurs? The generalized bone osteosclerosis occur, and what the multiple fracture, and it also responsible for non-union malunion, that is stony brittle bone. And also here we can see the marble bone. So osteopetrosis, it is the hereditary skeletal disorder characterized by increased bone density. So here the bone density is very increased. Bone density is due to defect remodeling caused by failure of the osteoclast function. That means the osteoclast is not well functioning. For this condition, bone resorption and bone remodeling is not possible. Bone is not reabsorbed, that means remodeling is not possible. That means suppose this is a bones, and during growing the different type of the excessive area or different type present. What osteoclast do? Actually this osteoclast, it remove the extra part, and it is responsible for the remodeling. But as the osteoclast is defective, now it is not possible for the osteoclast to do its normal function. So defective osteoclast resorption will continue bone formation, only bone formation, but there is no reabsorption, and endochondral ossification result, and also there is thickening of the cortical bone and calcaneus bone sclerosis. So what is the cause? That means what is the pathogenesis of the osteopetrosis defect? Which is the defect? The actual defect is the osteoclast function, and this osteopetrosis also known as the marble bone